I've had the experience where, as a patient, you go to an office and your time is supposed to be 10 a.m., but they don't see you until 10:45, and you're just there. It makes no sense. But I've had the other experience with the group I'm now. They have a group, like you were saying. And so their group maybe has a doctor and 2 or 3 nurse practitioners or 2 doctors or whatever, and they have their front desk staff and they sort of share it. But you go in and you're barely getting your cup of coffee and they're already calling you in, and you're just in and out super fast. Why? Because the business side of it is thriving such that they can have everything else around it, and you as a patient get better care.
Yeah, I mean, to this day, the thing that brings me the most joy is when I make a real difference in a patient's life, right? That is 100% the reason I got into it. I loved helping people. I loved the science of it. The best part of medicine was learning it. You know, being in medical school, being in residency, it's a very long road, but I love learning it and, you know, the whole process of becoming a doctor. But then, right, you get into real world and you've never been taught anything about the other side, which is how to actually run this whole thing and how complicated it is and convoluted it is, you know? Again, going back to like the Subway example, you give $5, you get, you know, your sandwich. That is not how this works. And then all the systems and processes about, like you said, trying to get seen on time. Like, is my practice the best at this? No, not by any means. You know, it's a constant, constant thing we also struggle with. To try to balance, right? I can't have 20 staff members just sitting around not doing anything. So it's a fine balance of everything. So yeah, it's something we ought to think about. But if the business part of things are kind of, you know, set, then yeah, you can definitely just focus a lot more on the patient.